Today I will be discussing how to support students with language disorders. So first we'll discuss what language disorders are, the difference between language disorders and developmental language disorders, how they may present in the classroom, some considerations, and tiered interventions to support these students. Firstly, what are language disorders? So the term language disorder refers to language difficulties that persist into middle childhood, which is about age 5, and continue beyond. These difficulties significantly impact social interaction and/or educational achievement. And I wanted to highlight that while students with a language disorder may fall into one of the categories of exceptionality, the presence of a language disorder does not automatically make it so that they have an exceptionality. Instead, it would depend on the degree to which the language disorder impacts said student. So what is the difference between a language disorder and a developmental language disorder? So you may often hear these terms used interchangeably, which you shouldn't hear because they are two different terms. So a language disorder is, or the term language disorder is used when the language difficulty is due to other biomedical conditions. So in this case, you would describe it as a language disorder associated with X, whether that be aphasia or dyslexia or so on. Whereas a developmental language disorder, which is commonly abbreviated to DLD, is used when there is no biomedical condition affecting language. So in order for a student to be diagnosed with a developmental language disorder, they first have to go through the process of eliminating any possible condition that could affect language. So overall, while the terms are similar, they are not the same. However, the supports and accommodations that are used to help these students are often extremely similar, if not the same. There are a multitude of ways in which language disorders may present in the classroom, and I am discussing these not because I believe that teachers should attempt to diagnose language disorders. We are not in a position to do that. However, similarly to many other conditions or disorders, early identification and intervention are extremely crucial and extremely beneficial to students with language disorders, and especially in the early years, us teachers may be the first ones to raise these concerns to a parent so that they, if they so choose, may move forward with attempting to get a diagnosis. When it comes to attention and listening, students with a language disorder or developmental language disorder may present as looking almost blank. So they may look like they're zoned out, not listening, not paying attention, but that is not necessarily the case. This could be simply due to the fact that they are struggling to process and understand all of the language going on. In terms of understanding language, this may present as difficulty following instructions, especially multi-step instructions, incorrect or off-topic responses to questions, difficulty listening to, remembering, and understanding explanations, a reduced ability to learn and understand vocabulary, including academic vocabulary. And these problems with understanding may be less obvious in some children, especially as you get into the older grades. These students may develop strategies to cover up the problems they have in understanding. In terms of talking and using expressive language, this may present as students using immature or less sophisticated vocabulary and grammar compared to their peers, using non-specific words such as stuff and thingy, jumbling up their words, or not being able to find the word that they want to use, trouble telling a story or recounting an incident, and they may use shorter and more immature sentences to express meaning compared to their peers. So for example, if one student says, "That boy cuts shapes out of paper with sharp scissors," a child with a developmental language disorder might say, "him doing cuts," although they mean the same thing. There's also a variety of ways behaviorally and socially that these may present. So they may present as being disruptive or getting into trouble. On the other hand, they may also be quiet and well behaved so that they can fly under the radar. They may get into conflicts with their peers but then have difficulty describing the incident. They may not be able to understand the rules of games or understand inside jokes. They may struggle to negotiate with their peers and have difficulty making and maintaining friendships. They may also use inappropriate language when speaking with teachers and struggle to remember the names of teachers and peers. They may also have difficulty managing and expressing their emotions, which in turn can result in verbal and physical outbursts. They may also struggle to understand and keep up with adolescent language and social cues, so this would include innuendo, slang, jokes, sarcasm, and intonation. And it's key to highlight that these students are at an increased risk of being bullied or exploited, and they may display low self-esteem and confidence and have an increased risk of mental health problems. Just branching off of this, some considerations to keep in mind. As I mentioned on the previous slide, these students are at an increased risk of bullying and exploitation as well as lowered self-esteem. So it's clear that the challenges associated with language disorders don't only apply to academics. It's important to take a holistic approach when supporting these students. Instead of simply focusing on their academics, be sure to also support their mental health and well-being. A study conducted by Ekstrom et al. Interviewed students with language disorders in order to see what their experience of language and communication in school was like, and they developed 4 main themes that they saw reoccurring within these interviews with these students, and those were: number 1, feelings of inadequacy and comparison with others; number 2, feelings of being misjudged and misunderstood; number 3, the importance of feeling safe and comfortable; and number 4, the significance of social and communicative context. Next, we're going to look at some supports that you can put into place in your classroom to help these students. I'm specifically using a multi-tiered system approach to these supports. So Tier 1 interventions are supports that are universal to all students, but may be especially beneficial to some. So it's similar to the saying you often hear used with accommodations, which is beneficial for all, necessary for some. The Tier 1 interventions work in that way. So one thing you can put into place is to position yourself to face the student. So this not only improves the clarity of your speech, but also allows the student to look at your body language for additional cues. You should also be sure to use clear and explicit directions. So for example, during transitions, instead of saying, "Get ready for your next class," you could say, "Class is finished, put your books away, line up at the door." You should also be prepared to repeat and rephrase essential instructions. So this may look like giving instructions to the whole class and allowing them to begin, and then going over to the specific student and breaking those instructions down into smaller steps for them. Additionally, you can include multimodal supports. So this would look like using multiple methods such as gestures, visuals, and written keywords along with your verbal instructions. You can also chunk large amounts of information, so breaking text into smaller sections makes it more approachable and less overwhelming for these students. And you can also organize content into visually distinct sections and separate instructions to help students manage tasks one part at a time. A simple way to do this is through color coding. Along with this, you can use meaningful graphics and icons, so being sure to use images that directly relate to the task and ones that support comprehension rather than what is most aesthetically pleasing. Also providing consistent keyword definitions, so this may look like having a glossary of new or frequently used vocabulary so the students can refer back to it as needed. You can also keep questions, or you should, keep questions and related text on the same page rather than having students flip back and forth. This reduces cognitive load and allows the students to focus more on understanding and learning. I wanted to be sure to include supports for communication participation. As I previously stated, these students may have difficulties interacting with their peers, so having these in place can help limit some of that frustration or difficulty they experience. So firstly, it's just creating opportunities for peer interaction between students with and without language disorders. This supports language growth without the negative effects for peers that may happen during times like recess. You can also explicitly teach conversational strategies, so introduce classroom discussion norms and talk moves. This can include having sentence starter posters placed in the classroom to help students confidently participate in conversation. You should also explicitly teach language structures, so explicitly support storytelling and oral language by teaching the components of language structures such as characters, setting, problem, and resolution, and offer alternative ways for these students to respond. So rather than recognizing that sustained listening and speaking can be tiring for all students, not just those with language disorders. So providing options such as drawing, mapping ideas, or other visual responses to demonstrate understanding. Tier 2 supports target some students rather than the whole class. This is often thought of as small group activities, which is one form of Tier 2 interventions. However, it can also be supports and accommodations that are only necessary for specific students. So in terms of differentiating language demands, you can adapt spoken and written tasks to language ability. So this would look like potentially simplifying texts and questions for students who use or understand short, simple sentences. So providing a brief message with a supporting image and basic questions instead of lengthy passages with complex comprehension tasks. This could also look like pre-teaching and frequently revisiting vocabulary. So you may pre-teach the vocabulary with the whole group and then pull small group to revisit this vocabulary. And you can also consider sending vocabulary lists home in advance to support family involvement as well. In terms of organization and task completion, you can use task plans or visual to-do lists. So these provide a clear list showing the required steps. You model this for the student how to check off tasks, and this supports independence and task completion. In terms of supporting written language, you can use visual frameworks and structured supports. So this may look like providing beginning, middle, and end boxes for stories, giving writing frames and templates to support planning and organization. Also explicitly teaching written language forms. So this helps students understand that written language differs from spoken language. Also supporting planning before writing. So you may poll a small group to plan out their work before they actually begin doing it, and potentially scribing for the student when necessary. Also providing them with sentence starters and language tools such as a word bank or something similar. Tier 3 supports are typically the most intensive and are frequently done one-on-one. In terms of language disorders and developmental language disorders, this often involves other professionals such as speech-language pathologists or SLPs. And it's key to note that developmental language disorders are a lifelong condition. This means that these individuals will likely need ongoing support and adaptations at different stages of their lives, and the support of an SLP can be greatly beneficial. They can help to strengthen the language skills to the greatest extent possible. They can increase understanding of individual needs so that educators, families, and other professionals can adjust their approaches and expectations appropriately. They can equip the individual and those around them with effective strategies to reduce barriers to communication and improve access to learning and social opportunities. And they can also help the individual build self-awareness and self-advocacy skills. Overall, this is to say that it can be extremely beneficial for the student when you, as the teacher, work with the SLP to help support them to the best of your ability.